friends, in hemodynamic disturbances, we studied the disturbances involving the volume and the disturbances of obstructive nature. In disturbances of this volume of blood, that we studied about hyperemia, congestion, hemorrhage and shock. These are the disturbances that are related to the volume of the blood. In this, we studied about what is hyperemia, what is congestion, and what is hemorrhage. Now, today we are going to discuss the most important topic, that is shock. Shock is important from the exam point of view also and in the clinical practice also. In this, we are going to study the shock. In this, what is definition of shock, second types of shock, then primary shock, secondary shock, then what are the causes of secondary shock, then pathogenesis of shock, stages of shock and the clinical manifestation of shock. In this, we started with the first definition of shock. In definition of shock, shock is defined as a clinical state of cardiovascular collapse. You have to understand definition. In this, what is shock? It is a clinical state of cardiovascular collapse that is characterized by an acute reduction of effective circulating blood volume and an inadequate perfusion of cells and tissue. So what is definition? Shock is defined as it is a clinical state of cardiovascular collapse. Means in this the cardiovascular system is affected. In this the total there is cardiovascular collapse and it is characterized by, what is the character of that cardiovascular collapse? In this, an acute reduction of effective circulating blood volume. What is the volume of blood present in the body? There is an acute reduction of that effective circulating blood volume, and that this is the first character of this cardiovascular collapse. And second one, an inadequate perfusion of cells and tissue. Means when there is reduction in the blood volume, that causes the inadequate perfusion. There is less supply of blood to the cells and tissue, and this whole character is defined as a shock, as it is a clinical state of cardiovascular collapse with characterized by an acute reduction of effective circulating blood volume. Blood volume in the body get reduced. And second one, that is inadequate perfusion of cells and tissues. Means due to reduction in the blood volume, the cells and tissue do not get the adequate supply of blood, that causes the clinical state, and that clinical state we defined as a shock. So this is the definition of shock. Then second point. In second point, the types of shock. In types of shock, it is broadly classified into two types. First one, that is primary shock, also called as initial shock. Second one, that is secondary shock, also called as a true shock. So what is primary shock? Primary shock, it is of short duration. And what is secondary shock? Secondary shock that occurs due to the hemodynamic derangements with the hypoperfusion of the cells. This is due to the secondary shock. It is due to the hemodynamic derangements and with hypoperfusion of the cells. In secondary shock, there is actual hypoperfusion of the cells and tissue. That is secondary shock. Hence, it is also called as a true shock. And primary shock, it is called as an initial shock. So, what is in this? Started with the primary shock. Primary shock is defined as it is a transient and short duration shock. What is primary shock? It is a transient, means sudden, and it is of short duration shock, that we called it as a primary shock. The primary shock having causes like, that is, it is caused due to the immediately after trauma or any severe pain or any emotional overactions like fear, sorrow or surprise, that causes the transient and short duration shock, that we called it as a primary shock. Primary shock it is caused due to, I will again repeat it, primary shocks are caused due to immediately after any sudden trauma, any severe pain, or any emotional overactions like fear, sorrow, or surprise that causes the transient and short duration shock, that is called as a primary shock. So what is the pathogenesis of that primary shock? How it occurs in the body? The pathogenesis of primary shock. In pathogenesis of primary shock, we see there is neurogenic vasodilatation. When there is sudden transient news is heard, or there is sudden trauma or severe pain that causes the neurogenic vasodilatation in the body. The nerve system is stimulated and that causes the vasodilatation in the body. When there is vasodilatation, that causes the peripheral pooling of blood. Due to vasodilatation in the body, the pooling of blood occurs in the peripheral region. So there is peripheral pooling of blood, and when the peripheral pooling of blood occurs, that causes a sudden reduction of vasoreturn to the heart. As there is vasodilatation in the peripheral part of body, that causes the reduction of vasoreturn to the heart. The blood supply which is going to the heart, that get reduced, and when that get reduced, that is called as a benign vasovagal attack. Due to this, there is a stimulation of vasovagal nerve, and that causes the primary shock. This is the pathogenesis of primary shock, that how the primary shock occurs. That is it is a transient. When there is sudden trauma or sudden severe pain or sudden any emotional overactions, that causes the neurogenic vasodilatation in the body. When there is vasodilatation, that causes the peripheral pooling of blood, and that peripheral pooling of blood causes the sudden reduction of vasoreturn to the heart, and that causes the stimulation of vasovagal nerve, that causes the benign vasovagal attack, and that benign vasovagal attack called as a primary shock. So this is the pathogenesis of primary shock. So what is the clinical presentation of that primary shock? Primary shock, it is very short duration and very transient, and it do not require any treatment. But what is the clinical presentation of that primary shock is the patient becomes unconscious with weakness and sinking sensation, pale and clammy limbs, then weak rapid pulse, low BP, and attack lasts for few seconds or minutes. This attack is for only few seconds or minutes. After that, there is recovery of the patient. This is only a sudden or a transient short duration shock, that having a unconsciousness, clinical presentation like unconsciousness, weakness, then sinking sensation, having paleness and clammy limbs, then weak rapid pulse, low BP, and attack that lasts for only for few seconds and minutes. So this is a primary shock. We see this primary shock in most of the cases in the girls. You also experienced it in the dissection room, when any girl that see the body that having a is giddiness or that is drowsiness. This is due to the primary shock, as sudden exposure to the new things that causes the transient shock, and that is due to the vasodilatation, peripheral pooling of blood, then reduced in the reduction of the vasoreturn to the heart, that causes the vasovagal stimulation. It is also called as a vasovagal attack, and that is called, we called it as a primary shock. So this is a primary shock. After primary shock, we are going to discuss what is secondary shock. Friends, we studied about the definition of shock, then types of shock. In this we covered the primary shock. So what is primary shock? It is a transient and short duration shock. Now we are going to study the second type of shock, that is secondary shock. Secondary shock, also called as a true shock. In this occurs due to how this secondary shock occurs. This is occurs due to the hemodynamic derangements with hypoperfusion of the cells. It is mainly caused due to the hemodynamic derangements and with hypoperfusion of the cells. Actual hypoperfusion of the cells that occurs in the secondary shock. Hence it is also called as a true shock. So true shock, it is classified into mainly three types, that is hypovolemic shock, then cardiogenic shock, and third septic shock. Along with this there are two more types of secondary shock, that is neurogenic shock and anaphylactic shock. So in this, these are the different types of shock according to their causes or the etiological factor that classified the shock into these types. In this, the first type is of hypovolemic shock. Hypovolemic shock means that is reduction of volume of blood. Then cardiogenic shock, it is due to the cardiac diseases, that is cardiogenic shock. Then septic shock, it is due to the septicemia. Then the fourth one, that is neurogenic shock. These are occurs following the neurological conditions, or this occurs due to the anesthesia or the spinal cord injury. When there is any anesthesial injury or spinal cord injury that causes the damage to the nerve, and that damage to the nerve causes the neurogenic shock. This is the fourth type. Then next one, that is anaphylactic shock. What is anaphylactic shock? That occurs following some allergic reactions. This is occurs after some allergic reactions due to some drugs or chemicals. When body is allergic to some drugs or chemicals, that causes the shock, that is anaphylactic shocks. And these agents like the penicillins, streptomycin, then insulin injection, B12 injections, when a patient is sensitive to that injections or that chemicals or that drug, that causes the anaphylactic reaction in the patient, and that anaphylactic reaction goes to the anaphylactic shock. This is a fifth type of shock. Mainly there are three types of shock. First one hypovolemic shock, second cardiogenic shock, third one septic shock. But these are two more special types of shock, that is neurogenic shock and anaphylactic shock. So in this we are going to see the three types of shock, that is hypovolemic, cardiogenic and septic shock. So started with the first type, that is hypovolemic shock. So what is hypovolemic shock? It is a reduction of blood volume. When there is reduction in the blood volume in the body, that causes the hypovolemic shock. And that hypovolemic shock, it may be due to the reduction of blood volume, and that reduction of blood volume, it is caused due to the first one, that is due to the severe hemorrhage. When in the body there is severe hemorrhage, that may be due to some external causes or internal causes, that is due to some trauma or due to surgery. When there is severe hemorrhage that occurs in the body, that causes the reduction of blood volume in the body. And when there is reduction in the blood volume, that causes the hypovolemic shock. Then it also occurs due to the fluid loss. When there is fluid loss in the body, that is, that fluid loss may occur when there is severe burn, or there is any crush injury, or there is persistent vomiting or diarrhea, that causes the dehydration in the body, that causes the fluid loss from the body. And when that fluid loss occurs in the body, that causes the hypovolemic shock, and it is due to the reduction of blood volume. This is the first type, that is of secondary shock, that is hypovolemic shock. Then next one, that is cardiogenic shock. What is cardiogenic shock? Cardiogenic shock, it is occurs due to the acute circulatory failure with sudden fall in cardiac output from acute diseases of heart without actual reduction of blood volume. So what is cardiogenic shock? It is due to the acute circulatory failure, when there is failure of circulatory system with the cardiac diseases, or with the sudden fall of cardiac output, that causes, when there is acute circulatory failure, that causes the sudden fall of cardiac output, and these are due to the some acute diseases of heart. These are due to some acute diseases of heart, and these are due to the actual reduction of volume of blood. So this may be due to the three factors, that is, it is due to the deficient emptying, it is due to deficient filling, and it is due to obstruction to the outflow. Means in the cardiogenic shock there is presence of some cardiac diseases, and that cardiac diseases causes the circulatory failure, and that circulatory failure causes the sudden reduction in cardiac output, and that sudden reduction of cardiac output causes the cardiogenic shock or shock in the patient. But this is most important, that is without actual reduction of blood volume. This is main in the cardiogenic shock. In the cardiogenic shock, the blood volume is normal. Actual blood volume is normal, but the heart cannot get the blood due to some defect in the circulatory failure. There is some circulatory failure that causes the reduction in cardiac output, but the volume of the blood in the body is normal in cardiogenic shock. But in hypovolemic shock, there is reduction of blood volume. There is actual reduction of blood volume in hypovolemic shock, but in cardiogenic shock there is no actual reduction of blood volume, but the cardiac output decrease due to some acute circulatory failure, due to some acute diseases of heart, and this may be due to, that is, deficient emptying of the heart, then deficient filling of the heart, or due to the obstructions through the outflow of the blood. In this, the deficient emptying of heart, in this the diseases are due to MI, that is myocardial infarction, or due to rupture of heart, or due to cardiac arrhythmias. These are the diseases that relate to the deficient emptying, means heart cannot empty properly, that is due to the myocardial infarction, it is maybe due to the rupture of heart, or it may be due to the cardiac arrhythmias. Then second, deficient feeling. When heart cannot feel properly, this may be due to some cardiac tamponade. These are the some diseases that causes the deficient feeling in the heart, and that causes the reduction in the cardiac output, that leads to the cardiogenic shock. Then the third one, obstruction to the outflow. When there is obstruction to the outflow from the heart, this may be due to the pulmonary embolism or due to wall thrombus. These are the some condition in which there is obstruction to the outflow of heart in the pulmonary embolism and wall thrombus. In this condition, there is obstruction to the outflow of blood, and that causes the reduction in cardiac output, that causes the cardiogenic shock. So this is cardiogenic shock due to the acute circulatory failure with reduction in the cardiac output from acute diseases of the heart without actual reduction of the blood volume. Remember, in cardiogenic shock there is no actual reduction of blood volume, but in hypovolemic shock there is actual reduction of blood volume. This is the main difference between hypovolemic shock and cardiogenic shock. Then the third type, that is septic shock. So what is septic shock? It is severe bacterial infection in the body, that we also called it as a septicemia. This is due to the two causes, that is due to gram negative septicemia or due to the gram positive septicemia. So what is gram negative septicemia? Also called as a endotoxic shock, and this is caused due to the bacteria like E. coli, proteases, Klebsiella, Pseudomonas. These bacteria secretes the endotoxin, and that endotoxin spread all over the body, and that causes the endotoxic shock, also called as a gram negative septicemia. And this is the septic shock due to the secretion of endotoxin by gram negative bacteria. These are the gram negative bacteria, that is E. coli, proteases, Klebsiella, Pseudomonas. These gram negative bacteria secretes endotoxin, hence it is called as an endotoxic shock, and this is the septic shock. And second type, that is gram positive septicemia. Gram positive septicemia means it is also called as a exotoxic shock. Exotoxic shock means the bacteria, that is gram positive bacteria, streptococci and pneumococci. These are some of the examples, streptococci and pneumococci. These bacteria secretes, these are the positive bacteria, gram positive bacteria that secretes the exotoxin. That exotoxin is secreted, hence this is called as a exotoxic shock. So these are the causes of septic shock, that is gram positive bacteria and gram negative bacteria. Gram negative bacteria causes the endotoxic shock, and gram positive bacteria causes the exotoxic shock, that we called as a septic shock. So these are the three types of shock. First, hypovolemic shock due to reduction of the blood volume. Second, cardiogenic shock due to the acute circulatory failure. And third one, that is septic shock due to severe bacterial infection or septicemia. It may be endotoxic or it may be exotoxic. And the special type of shock, that is fourth type, that is neurogenic shock. It is some neurological disorder or due to the spinal cord injury. And last one, that is anaphylactic shock. It is due to the allergic reaction. It may cause due to some allergens, it may cause due to some chemicals, or it may cause due to some drugs that causes the anaphylactic reactions in the body, and that anaphylactic reaction leads to the anaphylactic shock, and it is the most dangerous. It can lead to the death of the patient. So these are the different types of secondary shock. We are studying now the secondary shock. This is the true shock, that is actual pathogenesis of shock occurs in the secondary shock, that is hemodynamic changes that occurs and that leads to the secondary shock. So these are the different types according to their etiological factors, that is hypovolemic, cardiogenic, septic, neurogenic and anaphylactic. So these are the types of shock. After this we are going to study what is the pathogenesis of shock. So friends, up till now we studied the definition of shock, then types of shock. In this we study what is primary shock and what is secondary shock. In previous slides we studied the secondary shock and the types of shock, types of secondary shocks according to their etiological factors. After this etiological factor, what may be the etiology? It may be due to hypovolemia, it may be due to septicemia, or it may be due to cardiogenic shock. That causes the shock, and that shock having the common pathogenesis that occurs in these all shock. In this definition of shock, we studied the two factors, that is, it is a clinical state of cardiovascular collapse. In this, it is characterized by two factors, that is, in the reduction of effective circulating blood volume, and second one, that is decrease in the perfusion of the cells and tissue. In this, these are the two important factors that occurs in the pathogenesis of shock, that is decrease in the effective circulating blood volume, and that results in the tissue anoxia, and that leads to the condition that we call it as a shock. So it may be due to different causes. It may be due to hypovolemia, and hypovolemia due to hemorrhage, it may be due to trauma, it may be due to surgery, it may be due to burns, it may be due to dehydration. Any cause that causes the decrease in the effective circulating blood volume, or it may be due to some septic shock or septicemia, it may be due to gram positive bacteria, or it may be due to gram negative bacteria that causes the septicemia, or it may be due to cardiogenic shock, that is due to deficiency in emptying, deficiency in filling, or due to outflow obstructions. All these causes leads to the effective circulating blood volume, and when that effective circulating blood volume is decreased, that causes the second point, that is decrease in the venous return to the heart. When in the body there is decrease in the blood volume, when that blood volume decreases, that causes the decrease in venous return to the heart, means the blood which goes to the heart, that venous return also get decreased, and when that venous return get decreased, that causes the decrease in cardiac output, as the total cardiac output of the heart get decreased, and when that cardiac output is decreased, that causes the decrease in the blood flow, that is, after the cardiac output, whatever the blood goes into the systemic circulation, that also get decreased, and that causes the decreased blood flow. When that blood flow is decreased, that causes the reduced supply of oxygen to the cells and tissue. When the blood volume is decreased, that causes the supply of oxygen to the cells and tissue get decreased, and when supply of oxygen get reduced, that causes the tissue anoxia, means there is no oxygen supply to the cells, and when there is no oxygen supply to the cells, that causes the tissue anoxia, that leads to the secretion of many toxins, and that toxins leads to the shock. So this is the pathogenesis of shock. It may be caused due to hypovolemia, it may be caused due to septicemia, or it may be caused due to the cardiogenic factors that leads to the first one, decrease in the effective circulating blood volume. When that circulating blood volume get decreased, that leads to the decrease in venous return to the heart, and when venous return to the heart get decreased, that leads to the decrease in the cardiac output, and when cardiac output get decreased, that leads to the decrease of blood flow, and when that blood flow is decreased, that leads to the decrease in the supply of oxygen to the cells and tissue, and when that supply of oxygen get reduced, that causes the tissue anoxia. Means due to the less supply of oxygen, there is secretion of toxins by the cells and tissue, and when these toxins are secreted by the cells, that leads to the condition that we called it as a shock, and it is a total clinical state that leads to the cardiovascular collapse. In this, there is total cardiovascular collapse occurs in the shock, and this is mainly due to the two factors, that is characterized by two factors, that is decrease in the effective circulating blood volume, and second one, it is due to the tissue anoxia that leads to the secretion of toxins by the cells, and that leads to the shock. So this is the common pathogenesis that may occurs in the hypovolemic shock, it may occurs in the septicemic shock, or it may occurs in the cardiogenic shock. In this cardiogenic shock, it started with the decrease in the cardiac output due to cardiac diseases. It may be sudden MI, it may be due to pulmonary embolism, or it may be due to acute any cardiac disorder that leads to the decrease in the cardiac output, that causes the decrease in the blood flow, that causes the decreased oxygen supply, that causes tissue anoxia, and that leads to the shock. And in the septicemic shock, there is production of endotoxin or exotoxin that leads to the septicemia, and there is changes in the vascular permeability, that vascular permeability get changed, and due to this there is peripheral pooling of blood, and that leads to the secretion of toxin, and that leads to the decrease in venous return, cardiac output, decrease in blood flow, decrease in oxygen supply, and tissue anoxia that leads to the shock. So this is the pathogenesis of all types of shock that leads to the shock, or shock may leads to the condition that may recover, or it may turn into the death. So this is the pathogenesis of shock. After this pathogenesis, we are going to discuss the stages of shock in next part. So I think you all understand what is the definition of shock. Second point, that is types of shock. In this primary shock, this is a transient and short duration shock. Then it is also called as a pseudo shock. Then the main type, that is secondary shock. Secondary shock also called as a true shock, and it may cause due to the different etiological factors and subdivided into hypovolemic shock, septic shock, cardiogenic shock, and along with this there are two special types of shock, that is neurogenic shock and anaphylactic shock. And after this we studied about the pathogenesis of shock, and this is mainly depend upon the two factors, that is decrease in the effective circulating blood volume, and second one, that is tissue anoxia, and that leads to the shock. So thank you friends.